In your opinion, why did the doctor have those assumptions, and what change in perspective needs to occur to address Gary's specific concerns?
The assumptions are involving sexuality and sexual health, and it is the belief that a lot of society has that people with disabilities aren't interested in sex at all. It's like an othering. It's like we're not seen as normal. We're not seen as wanting the same things as everybody else. And we're just focusing, on what's wrong with us rather than, just living our life normally. So I think that piece is often forgotten, is that we want the same things that everybody else does.
People with disabilities have relationships. They're normal people. They have families. They have sexual relations. They do procreate. And doctors should understand that they're a person first and the disability second.
He wasn't really seeing the patient as a person. He was seeing him as a thing or a name, which, again, it's a form of closing the door.
If the doctor knows that these worries could or couldn't happen, then he should, talk to him about it.
Like, go in asking the same things you would to any other patient. Yes, it's important to see that the person has a disability. It's part of your interaction with them. It does not need to drive the interaction.
How would you enhance communication between the doctor and Gary?
I would think that, especially with him being blind, and this is really with any disability, is asking the patient what it is that they need for this to be productive appointment. How can he learn? So it really is asking the person, and that's the main thing. They don't have to come up with all the answers. They just need to broach to the patient, how would you learn best, for instance? How can this, information be explained to you differently?
He could have communicated better by listening, asking questions, and trying to make suggestions. If he doesn't know every answer, because no one does, he could always return to him or call him at a later time after he has looked up certain information and resources.
First, I would ask Gary, well, what is the best way for me to explain how I'm going to do this procedure, or how your ailment is going to affect your body?
Because the main issue is that he was so used to explaining through those graphs that he had, to other patients, that he didn't even think that of another way. It's as simple as that, is open communication and starting that dialogue of, how can I make this experience better for you?